the University of Toledo Medical Center, joined this evening by Dr. Kris Brickman. We thank you very much for your time, Doctor. We want to talk about the Internet today. Obviously, it's grown in popularity when it comes to information, also medical advice. Let me talk to you first about the advice you see people get on the Internet. Is it good advice? Is it bad advice? Should you always take it? Should you take it with a grain of salt? What are your thoughts on that?
Well, I guess firsthand, I haven't been calling in that much, so I'm not exactly sure, what they're actually telling you. But I guess, Sean, as I kind of look at that whole picture on the Internet, getting your medical advice, if it's nursing advice, I think that's pretty reasonable. I think it's okay to get some straightforward nursing advice regarding symptoms and problems that you might have and what the recommendations should be of whether you should see a doctor, whether this is something you could follow up with your family doctor, whether you take your kid to your pediatrician, or whether this is something you need to go to the emergency department right away from. I think that's pretty reasonable. Physician advice, I think, is a whole different ballgame, and I think that's where things get a little dicey, because I would find it as a clinician very difficult to really make a determination that you need to be treated, you need to be on certain medication, or from what I'm seeing and know about some of these sites, they're actually providing prescriptions to patients based on their condition.
Without even ever seeing anybody.
No evaluation done. So I have a little concerns over actually doing that to that level of management without doing an evaluation.
And speaking of prescriptions, obviously the Internet prescription world has grown leaps and bounds over the years. Your thoughts on ordering prescriptions over the Internet?
Not a big fan of that one either. I got to tell you, there has been a study that's been done recently that's shown that there's a very significant percentage of those medications are not as represented. Big surprise. You're getting these things, you're getting them for a fraction of the normal price, and the medication that you're supposed to be getting isn't what's there. Once you've already bought it, very often you don't have any recourse, can't return it, nobody's going to give you a refund, and so I can't really advise people to be getting any of their medications over the Internet.
Well, the pricing has got to be the big thing that people start off with. They're sick, they know the bills are going to start piling up, and if they can cut a couple of corners here and there, they try to do that, but what you're reading these days is they may not be getting what they think they're getting.
Well, and that's exactly what's been determined. When they did a study on these drugs that you ordered off the Internet, again, they found a very large percentage, greater than 50%, were not the medications that were represented, or were not to the equivalency that they said they were going to be, meaning this is 90% of this certain medication, it might have turned out to be only 50% of that medication. So for the most part, those have not really been a reliable source of pharmaceutical agents.
And that stuff's not regulated, right?
Not regulated at all. I mean, pretty much, anybody can, that's the problem with the Internet. Anybody can order it, anybody can get it. There's little scrutiny. So, quite frankly, there's no recourse if you end up, something bad starts happening.
Now, are you finding more and more people are starting to look toward the Internet to maybe in a convenience way?
Again, it's the economy. The economy dictates that, and of course, if you can find a cheaper option and somehow you believe it, you're going to tend to have people that'll go that direction.
All right, Dr. Kris Brickman, we appreciate your time this evening, and that is your Talk Back.